Hello students, welcome back to my channel Community Medicine Made Easy. Today we are going to have a quick revision of levels of prevention and modes of intervention, which is a very important essay question in community medicine in public health. First, coming to levels of prevention. So the objective of preventive medicine is to intercept or oppose the cause and thereby the disease process. Then write levels of prevention. It can be classified into four types: primordial, primary, secondary and tertiary. Then primordial prevention, that is prevention of emergence of development of risk factors. It is the most important thing in countries or population groups in which they have not yet appeared. So the efforts are directed towards discouraging children from adopting harmful lifestyle. Basically in primordial prevention, the target is children because the risk factor has not yet developed. Second is primary prevention. It is defined as the action taken prior to the onset of disease, which removes the possibility that disease will occur. We have two strategies here: population strategy and high risk strategy. In population strategy, the whole population, irrespective of individual risk levels, is targeted. So why you are targeting? An average reduction of blood pressure in the whole population, average reduction in CLM cholesterol of the whole population will lead to average reduction in the incidence of cardiovascular disease in the whole population. So the effort are directed towards economic, behavioral and lifestyle changes. Whereas in high risk strategy, it aims to bring preventive care to the individuals at special risk. See, by targeting the lower socioeconomic group, by raising the standard of living of that group, just by that measure alone, plague, leprosy and tuberculosis were controlled in the past. Similarly, primary prevention is applied to chronic diseases also. So it is a holistic approach. First of all, remember the primary prevention examples you write now: sanitation, infection control, immunization, protection of food, milk and water supply, environmental protection, protection against occupational hazards and accidents, all primary prevention. Basically, hand washing will lead to infection control. Immunization prevents the infection. Refrigeration of foods prevents the food spoilage. Garbage collection, solid and liquid waste management prevents the breeding of flies, ultimately leading to communicable disease control. Water supply protection and treatment leads to safety of water and infection control. So these are all examples of primary prevention. Write these examples. Secondary prevention is the action which halts the progress of disease at its incipient stage and prevents complication. The specific interventions in this stage: screening test is a secondary prevention. Case finding programs, adequate treatment, early diagnosis and treatment is secondary prevention. But usually the secondary prevention is the domain of clinical medicine and it is often more expensive and less effective than primary prevention. Next, tertiary prevention. It is intervention in the late pathogenesis phase. All available measures to reduce or limit impairment and disability and minimize suffering is tertiary prevention. It also includes psychosocial, vocational and medical rehabilitation, and it is a teamwork. Now, what are the modes of intervention? Write the 5 modes of intervention: health promotion, specific protection, early diagnosis and treatment, disability limitation and rehabilitation. Health promotion, the process of enabling people to increase control over and to improve health. There are 4 components in a health promotion, that is health education, which is one of the most cost-effective intervention. Environmental modification. Approach to health promotion requires environmental modifications such as provision of safe water, installation of sanitary latrine, control of insects and rodents, improvement of housing. Third is nutritional interventions, food distribution and nutrition improvement of vulnerable group, child feeding program, food fortification, nutrition education are all nutritional interventions. Fourth one is lifestyle and behavioral changes. In health promotion, a well-conceived program is that program which identifies the target groups and at-risk population. Then only the health promotion will be more effective. Now coming to specific protection, second component of modes of intervention. We have examples. Just write these examples. A, immunization. B, use of nutrients. C, chemoprophylaxis. D, protection against occupational hazards. E, protection against accidents. Protection from carcinogens. Avoidance of allergens. H, control of specific hazards in the general environment like air pollution, noise control, control of consumer product quality, safety of foods, drugs, cosmetics. These are all examples of specific protection. Third one is early diagnosis and treatment. See, early diagnosis and treatment is secondary prevention. It is not as effective as primary prevention. In secondary prevention, the critical thing is identifying the cancers, identifying hypertension, so that the cancer can be treated effectively. Hypertension treatment at the early stage will reduce cardiovascular morbidity in the later stages. Tuberculosis, leprosy and STD, early diagnosis will prevent complications. In early diagnosis and treatment, the mass treatment approach is sometimes followed for certain diseases. especially when there are more latent cases. Like for one case, there are 4 to 5 latent cases. In this scenario, mass treatment of the population is effective. Example, yaws, pinta, bijal, trachoma, filaria, we use mass treatment approach in early diagnosis and treatment. Fourth one is disability limitation. See, draw this like a flow chart. Disease, impairment, disability, handicap. Impairment, any loss or abnormality of psychological, physiological or anatomical structure or function. Example, loss of food, defective vision, mental retardation. Secondary impairment is in case of leprosy where damage to the nerves, like primary impairment is damage to the nerve, which leads to plantar ulcer, which is a secondary impairment. Second stage is disability. Here, disability is defined as any restriction or lack of ability to perform an activity in a manner or within the range considered normal for human being. Third one is handicap, a disadvantage for a given individual resulting from impairment or disability that limits or prevents the fulfillment of a role that is normal for that individual. So just draw this box. Accident is a disease or disorder. Loss of food is a impairment. Cannot walk is a disability. Unemployment is a handicap. The last, disability limitation. See, immunization against polio is primary prevention. Also, it limits the disability. Last component of modes of intervention is rehabilitation. The combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible level of functional ability. Write these 4 types of rehabilitation. Medical rehabilitation, restoration of function; vocational rehabilitation, restoration of capacity to earn a livelihood; social rehabilitation, restoration of family and social relationship; psychological rehabilitation, restoration of personal dignity and confidence. Write this example: establishing schools for blind, provision of aids for crippled, reconstructive surgery in leprosy, muscle re-education and graded exercise in neurological disorders like stroke. So if you write all these points, that is enough for an essay, which is on levels of prevention and modes of intervention. I hope this 8-minute revision video was useful for you. Kindly subscribe my channel, kindly become a member of the channel and support me in my efforts and endeavors to provide quick revision of community medicine, public health and global health. Thank you so much.